Oklahoma's revenue problems are exacerbating the difficulties faced by the state's mental health care system. More than 700,000 Oklahomans suffer from some form of mental illness, even as the state struggles with a shortage of psychiatric beds and health care providers. The shortages are only expected to grow worse as providers brace for more cuts in what experts say is an already overburdened system.
Oklahoma is facing a mental health crisis. That's the assessment of the person who heads up the agency tasked with helping people suffering with mental illness and addiction issues.
We probably have the highest problem in the United States as it relates to overall mental health.
Terry White is commissioner of the Department of Mental Health and Substance Abuse Services. White says the results of a recent study by the Federal Substance Abuse and Mental Health Services Administration underscore the problem in Oklahoma. The study shows Oklahoma's 5.24% rate of serious mental illness ranks second in the nation, behind only West Virginia at 5.48%. Oklahoma also ranks second for all mental illness with a rate of 21.8%, trailing Utah at 22.35%.
That is between 700,000 and 950,000 Oklahomans. So that's 700 to 950,000 of our friends, our family, our children, our co-workers, and so we know that the number's huge.
Mental illness is especially challenging for the state's homeless community. Dan Strawn is executive director of the Oklahoma Homeless Alliance.
Many mental illnesses are very treatable, but if you're living under a bridge, staying on your medication regimen and keeping your appointments with your psychiatrist or social workers, that can be really, really challenging.
About a third of Oklahoma City's 1,500 homeless report suffering mental illness or chronic substance abuse. But Strawn says homeless shelters are ill-equipped to deal with those issues.
That's not what the staff is trained to do. It's not what they're set up for. And so they can't accept the liability of having a floored psychotic person in the middle of a dorm with 30 other people.
The state's two biggest cities are trying to address that problem. The Altamont Apartments is one of 18 buildings scattered across Tulsa that house more than 600 people with mental health challenges. In Oklahoma City, the Homeless Alliance is preparing to break ground on new single-room occupancy housing for people suffering mental illness or substance abuse issues. Strawn says addressing the state's mental health issues would go a long way toward solving the homeless problem.
Honestly, if you could wave a magic wand and fix mental illness, including addiction, you'd be 90% of the way to fixing homelessness.
That's not so easy to do. 2/3 of all Oklahomans with mental illness don't receive treatment. White says money is a big part of the problem, noting that Oklahoma ranks 46th in the nation in per capita spending on mental health.
We have the second highest rate of mental illness, yet we're funded 46th in the nation, which means that gap is huge. We are only able to reach about 1/3 of Oklahomans who need help, which means 2/3 of people who are struggling with potentially a life-threatening illness are going without medication and without medical services every single day.
Tracy Cook is the executive director of the National Alliance of Mental Illness in Oklahoma. Cook says the gap for adults needing psychiatric care is growing worse. She points to a recent decision by the Oklahoma City Planning Commission to recommend denying Cedar Ridge Hospital in Oklahoma City a permit to house adult psychiatric patients.
They already have 36 adult beds, and those beds house around 2,000 people in a calendar year for services. So with that being taken away by the city, we will lose services for those 2,000 people.
White says the closure of Deaconess Hospital in Bethany last December further reduced the available number of psychiatric beds, a loss that reverberates throughout Oklahoma.
When Deaconess closes in Oklahoma City, not only does that send shockwaves through Oklahoma City, because we don't have enough beds as it is now just to handle the metro area, but that also impacts Tulsa. So the lack of beds in all of our major metropolitan communities, not to mention the shortage in the rural communities, means that people can't find the services they need when they need them.
While her agency received a $16 million boost in appropriations last year, White says they still haven't recovered from decades of underfunding and shortfalls created by the Great Recession of 2008-2009.
5 years ago, when there were major cuts across the state because of our revenue failure, we had to rip about $30 million out of the system for mental health and substance abuse. So when you take an already underfunded system, which only a third of Oklahomans have access to, and you rip dollars out, you can imagine how huge the gap is.
White requested a $21 million increase in appropriations this year, but when the budget deal was finalized, the agency saw its appropriation boosted only $2.2 million, an increase of just 0.7%. White says they're grateful for the increase.
But a lot of the dollars we needed just to maintain the same level of services to those clients whose pay source is Medicaid in terms of mental illness and addiction, we did not receive the funding for. So we're going to have to make some pretty difficult cuts to the Medicaid program as it relates to those people getting mental health and substance abuse services. One of the things we're looking at is rate cuts. But because our rates are already significantly lower than any other area of healthcare, it probably doesn't make sense. And we're talking about potentially a 17% rate cut to our Medicaid providers. That will mean doors closing. And that may mean that people can't get any services if their provider closes their doors.
Cook believes cutting rates will worsen an already critical shortage of mental health care providers as people leave the field.
You go to school for all these years, you want to serve the public. It's not any different than being an MD or any type of service, health professional, and then to find out you're going to make $45 an hour and pay $20 an hour to the person processing your paperwork. It's not a lot of bang for your buck.
Another area that could be scaled back is rehabilitative services.
Do we want to potentially look at limiting that service to those that are only the most severely ill? So those persons who have severe mental illness or severe emotional disturbance, which is the term used with children. That means people who may be on the brink, who could benefit from that service, would potentially be eliminated, but we could still keep the services in place for those who are the most ill.
White says her agency is in the process of finalizing its fiscal year 2015 budget. A decision on what cuts to make will be decided in the next few weeks.